Diabetes is a condition that causes a person's blood sugar levels to become too high. There are two types of diabetes. There is type 1 diabetes, also called the insulin dependent diabetes, or the juvenile diabetes, or the childhood onset diabetes. And then there is type 2 diabetes, also called the non insulin dependent diabetes, or the adult onset diabetes. And now, the insulin helps to regulate the blood sugar level or the blood glucose level. Insulin helps glucose to enter the cells of the body where it is used for energy. Diabetes comes about when the body is not making insulin at all, or the body is producing insulin, but it is not making use of that insulin it produces. So this can lead to high blood glucose level. In type 1 diabetes, this is also called insulin dependent. As the name implies, anyone that's got type 1 diabetes, you will be dependent on insulin for the rest of your life. You will continue having insulin injection or continue having insulin injections for the rest of your life because it is called insulin dependence. And what happens here in insulin dependent diabetes, your body is not making insulin at all, or your body is just producing small amount of insulin, so blood sugar keeps on getting high. Now there is type 2 diabetes, which happens to be the most common type of diabetes. In type 2 diabetes or adult onset diabetes, here the body makes insulin. There is insulin, but the body is not using it the way it should. The body is not making use of it. Okay, so because it is non-insulin dependent, you may not have to take insulin for the rest of your life. You can just take oral medications that could help to control the sugar levels. In type 1 diabetes, it can occur at any age, like the name implies, childhood diabetes, juvenile. Okay, so it can affect children and it can affect the youths in type 1 diabetes. But now in type 2 diabetes, it's mostly the elderly, mostly adults that it affects someone at a high risk of having diabetes. Number one is family history. Of course, we all know if diabetes runs in your family, okay, there is a high chance, there is a high possibility that the children or the offspring of the parents having the diabetes are at a high risk. Risk factor of diabetes is if you are taking steroids for a long period of time. Of course, we all know that steroids can increase your blood sugar level. So if you're on a steroid for a very, very long period of time, you can have diabetes. Number three is when you've got gestational diabetes, when you are pregnant, overweight, when you are obese or overweight, it can cause diabetes. Okay, so that's why it's advised that you watch your weight, you watch the things you eat, because in gestational diabetes it only happens when you're pregnant. During pregnancy your blood sugar level becomes high, and then when you give birth, your blood sugar tends to normalize. But then there are people who after giving birth their blood sugar is still very high, so this can predispose someone to having diabetes. Let's talk about the symptoms of diabetes. Number one is feeling excessively thirsty. You would want to drink water at all times. Number two is peeing frequently. So because you're drinking too much, you're urinating too much as well, especially at night. Number three is feeling weak. So because like I said before, insulin helps the body to make use of glucose, and glucose in return gives energy. So when this is not happening, you don't have energy at all. You'll just be feeling very, very weak at all times. Then four, there is weight loss. You'll just be losing weight. Number five, there is blood vision. It affects your vision as well. Number six, there is itching in your pelvis or vagina. In fact, you'll be having recurrent thrush infections. You'll be having recurrent yeast infections when you have diabetes. Do you know that many people who has got type 2 diabetes do not know? They don't know until it has until the diabetes has advanced in stage. That is now when they would know. Again, now let's talk about the complications of diabetes. So over time or over the years, if diabetes is not properly treated, you can have problems with your kidneys, with your eyes, with your heart, with your nerves as well. So, number one, if you have diabetes, long-term diabetes without proper treatment, it can lead to damage to the heart. At time, diabetes can cause problems with the heart, like you'll be having heart attack, you have stroke, you would have high blood pressure as well. That is problems affecting the heart when you have uncontrolled diabetes. Number two is nerve problem. So another one is nerve damage. So too much sugar in the blood can affect the capillaries that feed the nerves. There is something that feeds the nerve, and that is the tiny, tiny capillaries. So too much sugar can affect those capillaries that feed the nerve, thereby depriving the nerve of food. What happens to the nerve? They start to die, especially in your legs. Okay, so nerve damage when someone has diabetes mostly affects the legs. Okay, you would have numbness means there will be no sensation, you will not feel anything on the legs again. There is also tingling, the tingling sensation. You would also sometimes you feel pain or burning sensation in the legs as well. That is why most times, because the nerve in the leg is damaged, that is why most times most people that have got diabetes have wound on the leg and they don't even know. Do you know that someone that's got diabetes can match a hot object? They can even put their leg in fire, but they will not feel it because the nerve there is dead. You don't feel anything. So that's why it's mostly affects the legs. Okay. So speaking on nerve damage, diabetes can also damage the nerves that supply the digestive system, thereby causing vomiting, nausea. You may have constipation, you may even have diarrhea because the nerves supplying the digestive system is affected. Sometimes you eat, you vomit it, you have diarrhea, you have constipation. For men, diabetes can cause erectile dysfunction. You would notice that you are not getting erect the way you should be. It is affecting your the way you perform. It's affecting your reproductive organs. So you can't stand again. You can't perform as a man. Another complication of diabetes is with the kidneys. Oh, diabetes can cause kidney failure because the blood vessels in the kidneys are affected. So therefore, the kidneys cannot do their work properly. They cannot do their job properly, and this can make the kidneys to fail. All right, thereby leading to end-stage kidney failures. All right. Complications of having diabetes is called retinopathy. That is, it causes eye damage. Diabetes can cause eye damage because the blood vessels supplying the eyes, the retina in particular, is affected, and if this is affected, the person can go blind as well. Another complication of high blood sugar is foot damage. Like I said, the nerves that supply the foot is damaged. So that's why when someone has a diabetic patient has wound on the leg, they don't even notice, and then it is very difficult for that wound to heal because the nerves there are damaged. No blood supply is coming down there. So that is why it's very, 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 very difficult for a diabetic patient's wound, especially on the leg, to heal. And if care is not taken, it leads to amputation because it is not healing and it keeps on getting worse. So another complication of someone that's got diabetes is skin and mouth problem. They would have recurrent skin problems. They would have recurrent mouth problems at all times. Again, someone that's got diabetes can also have pregnancy issues. The life of the mother and the life of the child will be at a very high risk if the sugar level is not controlled. Sometimes if care is not taken, the woman might have miscarriage. So if you've got diabetes, you have to take absolute care of yourself. You have to go for a regular checkup. You have to regularly check your blood sugar. You stay away from things that you're not supposed to eat. If you notice any symptom, run to the doctor and complain. What are the management of diabetes? Eating healthy, maintain a healthy lifestyle, try and shed some weight, exercise regularly. This would help. Okay, and especially if you know that diabetes is in your lineage, you have to start early to take care of yourself. Make sure that you are conscious of checking your blood sugar at all times so that you will know if anything is going off. You have to tell the doctor your treatment should be started as soon as possible. All right, so I believe that this video would help someone out there. And if you're happy with this video, kindly like, share, follow my page, and also subscribe to my YouTube channel. Thank you, and I will see you in my next video. Bye bye.